Okay, this is a case that is near completion, and I want to show you something interesting that will come up quite often. This patient had crowding of the upper front teeth in kind of a reverse arc, and you can see how now everything is rounded out, and that looks a lot better because now light reflects off the teeth. The teeth are also aligned, and if you notice, the top teeth were coming down over the lower teeth, and now you see more of the lower teeth. So functionally, this is a much better bite because there'll be less wear over the years. What I want to show you, though, is this patient didn't mention anything, but others might notice, and perhaps this patient did notice, that now the edge of the tooth looks longer. And a lot of times patients will say, hey, when I started, my teeth were the same length. And now, why is this longer? Well, the reason is these teeth wore down even, but the teeth were at the wrong angle. You see how they were slanting going down like this. Now the teeth are upright. So they wore down based on their pre-existing position, and now we align them, and now it reveals that disparity that happened. The orthodontist is kind of like a structural engineer, and sometimes when we get things in the right position, we then need the facade of the building to push that metaphor to have some work done. So I'm going to propose to this patient that we consider doing a little enamelplasty. One other thing I want to tell you on this case, this also is very common. You see how this tooth looks shorter than these other two. In the most perfect aesthetic mouth, you would maybe see about a 0.5 millimeter disparity in height. But here we have more like a 1.5, almost 2 millimeter disparity. Now, you might orthodontically try to bring this tooth down so that you can get it to be more level. But when this patient smiles, it just so happens that this patient's lip line falls right at the line of the gum line, which is good. If this tooth were to be brought down, which is hard to do, to compensate for the problem, which is a short crown, that would bring the gum line further down. And when the patient smiled, you see a little bit of a gummy smile in that area. The answer for this patient is to leave this individual characteristic as it is, which maybe will be de-emphasized by reshaping this tooth, or add length to this tooth with some sort of bonding or ceramic veneer. And the same thing applies a little bit to this tooth as well, which you can see how it was slanted from the beginning of the treatment. So these are things you have to deal with in an orthodontic case. And Invisalign really brings these things to the forefront because you have this great imaging tool to help guide you and to educate patients. Take care.